I want to talk about this. Pregnant woman, 26, dies by suicide after extreme morning sickness leaves her bedridden with no relief. This is going to be heavy, but people really need to listen. Before I even get into the story of this 26-year-old, as someone who has managed patients with both nausea and vomiting in pregnancy, or NVP, and hyperemesis gravidarum, or HG, here are a few important points. Number one, this narrative that it's normal and it'll just go away as the pregnancy progresses, it's just a narrative. It's not something that anyone who's experiencing it should hear. Number two, telling patients they should be happy because having nausea and vomiting in pregnancy, or HG, is a sign that it's a healthy pregnancy. That should never be said to anyone either, because if you actually have it and you know what it feels like, it will make them feel guilty that they're complaining about the nausea and vomiting NVP or HG. Number three, obstetrical care providers are responsible, a lot of them, for either not treating it or undertreating it, and not recognizing the impact that severe NVP and HG has on the quality of life and the mental health of the patient experiencing it. They are hesitant or just won't prescribe medications because of the fetus and the effects any medications may have on the fetus, even though we have tons of safety data on numerous medications for the treatment of NVP and HG. But you can't have a healthy fetus if this happens. This is Jessica Cronshaw from the UK. Her mom says that her daughter took her own life while struggling with severe sickness, saying that no one took her illness seriously, and if one person had helped her daughter, it would have changed the outcome altogether. And she's right. And Jess said, it's like the hardest thing I've ever gone through in my life, the constant nausea, there's no relief. I just spend my days in bed. It's just horrible. No one recognized just how sick her daughter was, Susan says, sharing that Jess was given a medication but was advised not to take it because it could harm her baby. In November 2022, Jess was 28 weeks pregnant when she took her own life. Her daughter Elsie was delivered via C-section but died 4 days later. An inquest into Jess's death concluded that feeling unheard contributed to the deterioration of her mental health and that she was given incorrect guidance to stop the anti-nausea medication. The inquest also noted that Jess had not been referred to any mental health service or support. There is absolutely no reason that a patient with severe NVP, or even NVP, and HG should be told to not take medication. That is negligent and it's clearly harmful. We have numerous medications available to help these patients manage their symptoms. I recently wrote an article on inpatient management of HG because a lot of patients who have HG do need to be hospitalized. I even have an entire section dedicated to mental health considerations in these patients. Pause to read. I talk specifically about two medications, olanzapine and Mirtazapine, that are used to treat mental health conditions and can also be used to help manage the symptoms of severe NVP and HG. So if you're an obstetrical care provider, there is no reason why you should ever deny your patient medications if they need them, ever. And we have to acknowledge the impact it has on a patient's daily living and as well as their mental health, because it does. In fact, HG can be so bad that patients choose to terminate their pregnancies. We have to do better as a profession when managing these patients.